Welcome back. Now, nearly 20 million people die every year due to unhealthy processed food and drinks, fossil fuels, alcohol and tobacco. Well, that's according to a series of reports published by the Lancet journal. Senior researcher at PRICELESS SA at the Wits School of Public Health, Agnes Erzse, joins me now to tell us more about this. And Agnes, thank you so much for your time. I mean, this is quite telling, I have to say. Three industries, or a couple of industries here, who produce unhealthy processed food, drinks, fossil fuels, alcohol, tobacco, responsible for at least 90 million deaths annually. What is this series revealing about this data?
Yes, exactly. That's about right. Only 4 harmful products, tobacco, alcohol, unhealthy foods, and fossil fuels, cause at least a third of preventable death per year globally. So really, the Lancet theories on the commercial determinants of health, which is defined as the systems, the practices, the pathways through which commercial actors really influence both health and health equity, as well as planetary health, are called the commercial determinants of health. And commercial actors can contribute positively to health and society, and many do, providing essential products and services. However, some of these actors, particularly what you call as transnational corporations, they're escalating avoidable levels of ill health, and they cause damage to the planet and inequity within and between countries. And these are the massive global health problems that this new series in the Lancet, which is a leading, prestigious global health journal, has just released last week, Friday. And today we saw the South African local launch event at the Wits School of Public Health, attended by the Department of Health, panelists from HeLa, civil society, Department of Education, and so on.
I mean, if these 4 industries alone account for at least 1/3 of global preventable deaths, how significant is this information, not only to consumers, but to exactly some of those who attended the launch out at Wits University, members of government, policyholders, health and medical experts? How significant is it to have this information reaching the masses so that we can reduce these numbers of deaths?
The significance is that there are existing policies that enable the cost, for example, of harm caused by some of these commercial actors' production, and then the consumption and the disposal, and they externalize all these costs, which comes at a very, very great cost to society, to government, and to individual families and individuals. For example, the treatment of associated diseases, let's say your diabetes, hypertension, cancer, it's mainly paid for by governments and individuals, and these companies are not carrying this burden. In fact, they're making profit, and they are not pulling their weight in paying for the cost that they cause. In South Africa alone, for example, obesity, to treat obesity, the direct and the indirect cost per year, it's around 80 billion rand. And this is just obesity that can be linked to all your ultra-processed foods, which are flooded in our supermarkets. And you go into a supermarket and all you can see is all these unhealthy products. And you might think that, yeah, I'm free to choose whatever food I can afford and buy. But really, it's coming down to not the individuals anymore. We can't be blamed for eating, for example, unhealthy foods. Is the system, is the corporations who are making us sick, who are creating this environment through marketing, pricing, and through availability, that's really limiting our choices.
And I'm glad you raised that question around profits, or, the right to health, the right to access to correct information around health practices, what we consume, as we compete with what we see, the visuals, the marketing, the billions of rand, supposed dollars as well, invested by these corporations in what we see in as far as healthy foods are concerned. Agnes, what do you think needs to happen next? What are the next steps do you think need to happen to change this, to have a shift, post this information as far as processed food is concerned, fossil fuels, alcohol, tobacco? How do we turn this around and keep the numbers low?
Right. So the Lancet theory and all these academics across the globe proposing a couple of ways of doing this. For example, most importantly, these are comprehensive approaches. There's not going to be a magic bullet. There's not going to be a quick fix. But where we can start, for example, is looking at developing some kind of an international convention on commercial determinants of health. In practice, for example, this could mean the replication and the expansion of what has happened, led by the World Health Organization around tobacco, for example, a framework convention on tobacco control, which since 2003 has been implemented and provided a guidance for policy, for evidence-based effective measures to curb the consumption of tobacco. So, for example, we can expand this model, this convention, and include all the harmful industries that you listed very correctly as well. And this would also accompany with rethinking our political and economic system. There are countries who are focusing, for example, the so-called well-being economies and well-being models where they're really trying to make sure that commercial entities pay their fair share of taxes, for example, right, and then they are obliged to account for the full cost that they're causing, the damage, both environment-wise and both health-wise. There are examples for this in Scotland, in Wales, in the UK, in New Zealand, but also in developing countries such as Brazil, Bhutan. So there is a lot to learn.
All right. Well, we'll leave it then. I appreciate you speaking to me about this. Senior researcher at PRICELESS South Africa at the Wits School of Public Health, Agnes Erzse, thank you so much for your time. Very, very insightful three-paper series that has launched by Wits University. Quite a read. I would encourage everyone to go through. 4 industries account for at least 1/3 of global preventable deaths. About 90 million deaths annually being caused by processed foods, unhealthy ones, drinks, fossil fuels, alcohol and tobacco.